Joyce Gibb. Thank you so much for being with me today. And I've had many emails recently about acne, adult and teenage acne. So why does this happen? First of all, many times it's tied to the diet, the standard American diet, the SAD diet. High consumption of white refined carbs, limited, colors of the rainbow, live whole foods, limited live whole foods. And I can tell you that I've seen this more and more as I've been a nurse practitioner, even since 2003. It just seems like the acne that kids are getting now, it's cystic acne, which is big, ingrown cysts, and it's very painful for the person to have that. So what can we do about this? So first thing I always do is completely take someone off of dairy. So why do you say dairy? Dairy is inflammatory. Okay, so dairy consumption increases the sebum, which is the thickness of in the pore. Okay, and so dairy. So you take somebody completely off dairy. That's the first thing. Ideally off of wheat too, because that can cause inflammation. But most kids need to be off of dairy. And then there's also another component of this, especially with guys. They wear their shirts when they're working out or in sports or whatever, and they get all sweaty. And so you naturally have, it's called Staphylococcus aureus on your skin. And if you have pads that are rubbing, like even some professional hockey players, you can see on their faces, they have acne right where the pads go around their neck and then on their face. And then they're sweaty underneath all this gear, like in football, and hockey too, and their skin can't breathe. So all that stays in there, it gets hot, and their skin can't breathe. So, what do we do about that? There are some products that we use that you can actually wash your face with, because some people, when they use certain agents that are over the counter, they're very drying, and you want the oil to go away, but you want it to be too drying, because when it dries up, then it scales and gets even more inflammation and redder patches. So number one's diet. Make sure that you don't use too many products that are going to dry your skin. Eat a live whole foods diet. Still exercise is good, and really limit dairy. That's the main things. There are some products that we have in the office here that we usually recommend for people with acne to put on twice a day. One is a skin cleanser that's very mild, that you just put on the acne-prone areas, sometimes on their shoulders. They get acne, or on their chest too, especially girls or guys. But a lot of it's because the sebum gets thickened from dairy. So so you wash your face twice a day, and then there's another product that has niacinamide in it, which helps reduce the inflammation. That's put on twice a day. And the third one is salicylic acid, an ingredient that's in another product that they use twice a day. So this reduces the inflammation. You reduce the sebum production with decreased dairy and opening up the pores, and just trying to be cleaner about themselves. Now, some girls, women more specifically, they actually have, it's called can be correlated with high testosterone, but it's called androsterone. We do this, we check these levels on a Dutch test, the dry urine test for comprehensive hormones, and they have to do it when their hormones are at the peak, days 19 to 22, day 1's the first day of your cycle. So we check their hormones, and many times some women have, it's called high androsterone, and it's a metabolite that makes testosterone, but it's 3 times more potent than testosterone itself. So, high testosterone correlates with polycystic ovarian syndrome and increased acne. And then you get hair growth on your face for females where they don't want it to be, hair loss on their scalp, their hair starts thinning. So there's some, natural products that we can use to help limit that in addition to changing their diet. And one of them is called saw palmetto with pygeum, and that's 2 twice a day. And that lowers that androsterone, in addition to changing their diet, exercising, and really a keto diet is very good for people with acne because the sugar, keto is low sugar, good fat. But the keto actually helps reduce blood sugars, which is very common when you have polycystic ovarian syndrome. They almost have a pre-diabetic diabetic picture, so that helps them too. But I'd love to help you. If you know anybody that needs help with acne, and it's really sad. I hate to see these kids that get teased and everything with acne, and I really have empathy for them because I had a little bit in my lifetime. When I was young, they just put us under ultraviolet light and did some antibiotics. But that's not good for your gut either. So I'd love to help you with trying to regain their health and to reduce the acne. So give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.